Q&A. Oh, just one more thing. I'm going to start with your questions. Now you can still ask questions if you want to. I wanted to say something about the discount code. It's ProWeb100. Someone emailed me after the last webinar, and apparently they had a problem using the code. If you run into a problem like that, please email me or email our support, and we'll sort that out, because the code should be active and working. Anyways, onwards to your questions. Is there any connection between hair pulling and schizophrenia? I have Trick and several other close family members hair pull, but not as much as I do. And recently a family member experienced a psychotic episode and suddenly began hair pulling very aggressively and has several growing bald patches on his head. There's no significant connection. When we look at co-occurring conditions, so comorbid conditions, schizophrenia is not one of the most common ones. The most common conditions that come with trichotillomania are other body-focused repetitive behaviors. So about more than a third of people who have trichotillomania also have dermatillomania or skin picking or nail biting. So that's most likely to come. Then OCD and anxiety disorders, and then mood disorders and borderline personality disorders. So schizophrenia is very, very low on the list, but I believe I can provide some explanation of what you're writing here with no pretension of giving you the most comprehensive explanation, because the only information I have is the one you provided here with me. But when people experience a psychotic episode, sometimes a very intense and qualitatively very different form of anxiety tends to accompany it. And we know that hair pulling has a soothing component to it. And with schizophrenia, as I said, anxiety has a different quality, and it also a different quantity. It tends to be quite intense. So this aggressive hair pulling could just be an attempt to aggressively self-soothe. It maybe just indicates that it's a coping mechanism. And you also mentioned that several other family members have it. So it's something that circulates in your family as a possibility, as something that people have in their repertoire of behaviors, or at least in their minds. And it could be that this person simply reached out for it, but it's not effective enough. It's not enough to pull one hair and self-soothe. When it comes to this intense anxiety in schizophrenia, then hair pulling will also be more aggressive. In this case, I think treating schizophrenia, especially if it's an acute episode, is of course the absolute priority. So hair pulling can wait and should wait until antipsychotic medication, does its work. We had a hard time staying connected. Will I be able to watch that later? Yes, sure. I will upload the webinar tomorrow, so it will be on our YouTube channel at some point tomorrow during the day, and you will be able to play it, and you will also receive a recording in your inbox, I think on Monday or maybe even before. So of course you can. Let me see where else. Does ABA or ABA behavioral therapy can help with habit reversal on an 8-year-old girl who pulls her hair and puts it in her mouth as sensory? My daughter is also taking occupational speech therapy for mixed receptive expressive disorder and CBT therapy. Well, just from what you wrote here, if you add more therapy to what your daughter is already experiencing, it might be a bit overwhelming for her. But an 8-year-old can very easily do habit reversal training, so it should not be a problem. In fact, it's something that you can also do with her. I don't know if it's still on the website. I think it isn't, but we had a self-guided manual once, long time ago. We also have a program for parents where our therapists can teach you how to apply habit reversal to your daughter's condition. So it's something that you can also do at home. But if she's having occupational therapy and speech therapy, And then CBT therapy, you didn't clarify for what, but all that taken together can be a little too much maybe for her. Remember, self-soothing behaviors come into play when someone is overwhelmed. So, therapy can be overwhelming. So just keep that in mind. Otherwise, absolutely, 8-year-olds can do habit reversal training and can do so successfully. Why is there such a lack of research on trick? Is it because there aren't enough people who want to practice and participate in studies, or is it because there aren't enough scientists and scholars who are interested in studying trick? I would say yes to both of those. People don't seek help for trick nearly as much as, well, I don't want to say they should, but let's say that far more people struggle with hair pulling than they actually seek help. Many people just consider it an annoying habit and they try to deal with it on their own. For example, our webinars are very well visited every time. There are many people who will email me after the webinars, and they will explicitly say that they're very much ashamed, or they're just not in that place where they recognize that they should go and have a mental health professional help them. And then when we have people who come to our program is anonymous. So it's easy to apply for a program where no one ever has to see you unless you actually want to attend a support group. Otherwise, no one ever knows your name, no one knows where you live. So it's completely anonymous. And then people seek help. If you want to participate in a study, that is not possible to do in that way. You can't do that from the comfort of your own home. So when there's so much shame and stigma, obviously there's that component. And I don't know if scientists aren't interested in studying trick. I think even among researchers, you just don't have enough awareness. This is something that deserves studying. It's not like schizophrenia or bipolar disorder, where you already have like a century of research that's being done and a certain degree of prestige. I know it's ridiculous that I'm saying this, but that does play a role in what researchers choose to study. And then there's also the fact that scientists have to get money for their research. If you go, and see some rich guy and tell him, look, I want to study sensory processing in trichotillomania, he's very likely just going to look at you and say, I didn't understand a word of what you just said. So in that sense, there's also that side. Like, you have to get funding for research, and it's far easier to get funding for something that people already recognize as a public health problem. And with all the shame surrounding trick, not many people talk about it. I remember, I think it was last year or the year before, it was sometime at the onset of the pandemic. I'm completely lost in time since COVID started. I remember when Amy Schumer talked about having trick, how it kind of rippled through through the whole community, and everyone that was in the program or in the support groups or working with me in some other capacity, everyone told me at some point, oh, did you know Amy Schumer has trick? So if more people would speak up that way, I can guarantee you that money would be found and scientists would be more than interested in studying trick. So ultimately, that's what it boils down to. And there's also that component that in order to get people to study something, I mean, this is all very non-scientific that I'm telling you, but those are things that do affect science. For example, think about, like, what is it that we have new medicines for? We have quite a lot of medication for psychiatric disorders coming out. We have like a lot of blood pressure medication. Like, we have a lot of medication for chronic illnesses. On the other hand, antibiotics, not so much. I don't think anyone does this on purpose. So I don't want to say that there's like a conspiracy of any kind. That's not at all what I think or what I'm trying to say. But it's just that pharmaceutical companies have their own financial agenda at play. So they're not going to sponsor research for something that they simply cannot cure. Because in order to get to the point where we can look for some specific medication for trichotillomania, we would have to have a very good understanding of its neurobiology. We have almost none. We can assume, we can extrapolate, we can conclude things based on what we know, how the brain works, but we just don't have the studies. So there are no drugs approved by the FDA. So in that sense, even those interest groups don't have any particular incentive to participate at this time. So trick, unfortunately, and all other BFRBs end up kind of disregarded in that sense. And so let me see what the other one. I feel a physical need to pull, like my scalp itches and physical sensation, not just triggered by stress. That is quite possible. I mean, I absolutely believe what you're saying. I would just, when you talk about the itch, I would separate it into two different components. The itch is obviously always physical, but itches can be a result of stress or chronic anxiety. In fact, one of the symptoms of chronic anxiety is skin itching. I don't know if you've ever seen, but anxious people tend to scratch their skin very frequently. I've seen clients of mine in therapy with like very clear scratch marks along their skin because their skin itches. On the other hand, an itch can be caused by something that's actually on your skin or in your hair root, like if you have dandruff or a very dry scalp. If you're, I don't know what your age is, so I don't want to assume, but if you're older, for example, your skin will change its quality, and then older skin tends to itch more frequently. So that is also something that it causes an itch. So even if it's not immediately caused by stress, my point is it doesn't mean that it's not psychological in some way. When you were introducing grooming, you were making the comparison to animals. However, when we moved into the sensory input, especially the move from itch to scratch, this is similar with animals also. I have cats who scratch their itch, but moreover, some felines develop anxiety and overgroom. I'm not trying to justify my actions, it's just an observation. Yeah, this is why I was talking about this, but because there definitely is that connection to our, furry friends. But at the same time, we do that as self-soothing behavior for sure, absolutely. My dog doesn't do that, but she does other behaviors that are obviously self-soothing behaviors. And sometimes when I see my dog, I think, my God, she behaves like a baby or like a child. I mean, child, I'm flattering my dog, obviously. But yes, so these are some mechanisms that we have. But when you talk about someone having to have, let's say, hair that doesn't have split ends, I don't think your cats, I would be very surprised if your cats had this idea of what split cat hairs are. So in that sense, there is a very good part of what we consider that needs to be groomed at all that is just purely cultural. But grooming behavior obviously is present in different animals, and it does have a self-soothing quality sometimes. Absolutely. There's I've read I forgot who the author is. There's like 4 authors of that book, but they talk about birds having this kind of obsessive grooming when they're being stressed in some way. So absolutely, what you're saying has merit. The reason why I was emphasizing that side of things is because I've noticed a tendency. It wasn't always present, but maybe in the past like 7 or 8 years, that people suddenly started explaining everything. I'm not talking about scientists, just like people who come to therapy, so people I work with. They started suddenly explaining everything with genetics and with biology. And whereas obviously we are biological beings, so that certainly plays a part, I feel like it's being overplayed to the point where it's used as a crutch to say, well, I just have this thing and it's genetic and what can I do about it? So that's why I was emphasizing the cultural and the psychological side of it, because even if self-soothing behavior is, let's say that there is a genetically programmed self-soothing behavior that involves hair pulling. Let's say that one day scientists isolate a specific set of genes that regulate this. I mean, I don't suspect that will happen, but let's just go into biological reductionism all the way. Then how much you will need to self-soothe is still determined by the kind of lifestyle you lead. Anxiety doesn't come out of thin air. Some people are maybe more prone to anxiety, but your lifestyle can still reduce anxiety or increase your anxiety significantly. And if we only focus on what is encoded in our genes, we just might as well give up on half of the stuff that we do. That's the reason why I always emphasize psychology. It's not that I have anything against genetics. It's just that I think that when we focus on those things, psychotherapy is never going to change your genes. It's just not how therapy works. But therapy can change all this other stuff that can make your life much better. So what I'm trying to do there is kind of shift your mindset to think in terms of where you have agency and when you have the ability to change versus where you just, can't do anything about it. It's kind of like losing weight. Like there's certainly a genetic component to that. The need to eat is absolutely a genetically conditioned thing. It's a biological thing shared by, all living beings, I presume. But still, the kind of food we will crave, there's no such thing as a gene for a hamburger, or a gene that says you have to have orange juice. So in that sense, even if it's biological, it is heavily modified by culture. Like we don't only eat when we're hungry. We will feel hunger, but sometimes it's because we're sad, not because we're actually hungry. So this is also self-soothing behavior, but it is something that is very much culturally determined. You're not going to get up and eat and stress eat a lobster. It's going to be chocolate, because that is what culture teaches us, that's how we do things. And it's these places where psychotherapy can intervene and change things and can do so successfully. So from my point of view, it's much more useful to emphasize where we actually can change things than where we cannot change things. That's the reason why. Otherwise, of course, if I lift my hand up like this, I'm certain that there is a chemical correlate, but it's not useful for my everyday life. Unless I want to write off my responsibility to take care of myself and say, well, I can't change because it just is what it is. Let me see. Sorry, I just scrolled accidentally. Okay. When I lay in bed and start pulling my hair, I observe the roots and touch my lips and feel the hair also. I hear the sound of hair getting separated from the root in my head, and it's very soothing. Oh, this is very interesting. I love being proven wrong, because if you remember, I said that the auditory input is not relevant for most people, but thank you for sharing this. This is very useful and very interesting. I would be curious to see, if you don't want to share it here right now, that's fine, but you can email me. I'm very, very curious to see if someone else has this similar sensation. And I wonder what that sound is like. If you're still here, I don't know what time zone you're from, and because this comment was written a while ago, if you're still here, maybe you can describe what that sound that you hear is like, and if you can maybe compare it to something so that the rest of us can get a better grasp on it and understand it. Thank you very much for sharing that. I am exactly as you described. I pull coarse hairs because I enjoy touching the rough texture. Biting a big bulb of hair, cutting the thick hair with my teeth. Without these post-pulling activities, I get no pleasure or relief from pulling. So take my advice and go and try to find some natural material that will emulate the texture of the hair. At least that part you can partially replace. You can also, sometimes people who, when they pull their hair, they keep their hair for a while. You can make a point of using that hair that you keep and then use it as a source of further stimulation so that you don't have to pull any more hair. If you go to a hairstylist, you can pick up some of the hair and bring it home. I've had clients who have done that before, and then they would use that as a stimulus. I don't know if that's a sustainable solution, but I've had clients who would do that. Post-pulling sensation for me is usually moving the hair root on the back of my hand to feel it, or sometimes if I'm studying, I put it on the paper and press the hair bulb to get the black material from it onto the paper. So this is a rather complex set of actions here that you describe. Which of the, if you don't know, you can test yourself and see. Try skipping one and then next time skip another one and see which one of these is crucial, like which of these sensations is the most important one or actions, And then this is what you should look to replace. Because to find a way to replace all of this seems rather complex. Except for the squeezing part, you can use, you can see if maybe wrapping paper, like people who pick their skin will frequently, like if they squeeze their acne, they will frequently use that wrapping paper because that gives them a certain sensation. And then there's a tool, a toy, I don't even know how to call that, something that appeared on Etsy. And I can dig up a link, someone had sent me that once, where it's a tool made for people who pick their skin. So you can put some kind of a glue or material in it and then pick it. It's actually meant to be picked. So maybe that can help you with the squeezing out part of the ritual. Has there been any research on this condition running in families, and can I pass this on to my children? So from the short answer is no. The longer answer is that every therapist who works with people who have BFRBs or even anxiety, if they pay attention to the families, they will tell you that patterns tend to run in families, but this is not necessarily because you pass on the genes that will somehow produce trichotillomania. It's because kids somehow see what you do, and then they learn what the emotional benefit of that is. And they might not imitate you in front of you. They might not say anything, but in stressful times, they might simply just pull out that behavior because they've witnessed it somehow at some point. I've even had clients, usually female clients, who were groomed by their mothers at certain points, and then their mothers would tell them, well, this hair doesn't belong. And then it might not even feel that good in the moment, but 10 years later, when something stressful happens, or when they feel that their life is out of their control, they can sit in front of the mirror and think about that and say, well, this doesn't belong here, and that I can control, unlike everything else in my life. So the way that these patterns are transmitted is not necessarily genetic. There are many different ways, including epigenetic ways of transmitting them. So you don't have to be worried. Just make sure to seek help and give your children a healthy coping mechanism, because a huge part of trichotillomania is not being able to process difficult internal experiences. So if you give that skill to your kids, then hair pulling will not be necessary, won't be needed. Here are a few people that say that they have the feeling that is a mix of pain and pleasure when they pull. So this seems to be a very common thing. And that feeling, like if that's what you seek, this is why I always say that you don't replace it. You don't find identical replacement, just because that feeling that's neither pain nor pleasure, clients have a very hard time telling me what else feels that way. Sometimes they will say an orgasm, which leads me to think there is a term in Lacanian psychoanalysis that's usually not translated into English. In French, and I apologize to any French speakers out there, I believe it's called jouissance or jouissance. I don't know how to pronounce that well, but that would be this kind of feeling that just blows the whole pain-pleasure dichotomy. It's beyond both of these. And orgasm would be one of these places. And that's sometimes what my clients tell me, like, that's what it is, but I can't exactly replace hair pulling with that every time. Is there a link between autism and trichotillomania? Yes, but in exactly that order that you just listed. Overwhelmingly, people who have trichotillomania don't have autism, and they're not on the spectrum. However, autistic persons will have trichotillomania because, again, it is a self-soothing mechanism, and it is a self-soothing mechanism that heavily relies on that sensory thing. And sensory stimulation is something that is well researched and well documented in autistic children. If you type that if you go to PubMed and type that, you will find thousands of papers on the subject. So that would explain the connection right there. Someone said, like, urge surfing, question mark. urge surfing is a very good way to build tolerance of unpleasant sensations. If that's what you meant, if not, then please clarify. But if that's what you meant, then yes, that is a very good technique. Impact of NAC or NAC. So the NAC is a supplement and acetylcysteine. It has been tested in several studies. About half of the people will benefit if they take it, and the result will be that their urges will diminish for about 50%. I think one of the studies said 48%. So about half of the people will benefit. It's not harmful. It can, at worst, it can cause some kind of gastrointestinal problems. But if you slowly increase the dose, it should be rather safe. It's available without any prescription, so it's easy enough to try. Give it 3 months. If you don't experience anything after 3 months, you're very likely not going to benefit from it. You can check out the studies. The doses that have been used in studies go up to almost 3 grams, so quite high doses. So that means that people also tolerate it well. So every other person will benefit from it. So give it a try. It's also something I have to say that has not been approved for trichotillomania officially, but it is widely used. Is there a nurturing component to hair pulling? Both my parents have had it, and my little sister as well as me. Yeah, I was talking about that just previously, so I don't have anything much to add. Absolutely. I think most commonly when it runs in families, that's exactly how it runs. It's a learned behavior. It's just that when we're little, we internalize behaviors from our parents without knowing it, and sometimes even without remembering it, because we're like little sponges at that time. And little sponges that are uncritical, so we don't judge our parents' behaviors. We just see something and it just gets sucked inside. My dermatologist had said that since I have been pulling my hair for 10 years now, there is a chance that the roots will die and it won't grow anymore. This has made me anxious. Is this true? So we had a webinar, I think, it wasn't last month, but it was maybe 2 months ago, that specifically dealt with this. It was about hair and functions of the hair and how hair grows and regenerates. Usually hair grows back, but the more you pull, it takes much longer for it to regrow. So sometimes 3, 4, 6 years even, but it usually does regrow. Those times when it doesn't is when you pull. Sometimes you might injure the skin and cause a little inflammation, and then it causes a scar. So that's when it doesn't grow back, or it takes a very long time for it to grow back. I wouldn't panic. I would focus on reducing my pulling. And then you can there are a lot of supplements that you can take, topical or in the forms of pills or tablets, that can stimulate hair growth. So there is something that you can do about it, but being anxious, I don't think helps, because it will take time for sure, but the longer you pull, the more time it'll take. So focus on getting your pulling under control, and hair will grow back in its own time. My trichotillomania is caused by childhood trauma, stress at that moment. What may be the first and important step for me to overcome my trichotillomania? Earlier I had, sorry, this is a lot of letters are, you've pulled from different places than you pull now. So there's, first of all, like the simplest way to start your healing process, not the complete solution, but the simplest place is habit reversal training. If you're certain that your trichotillomania is tied to your childhood trauma, and I've seen that many times, so it does make sense to me, then you probably need to find someone who knows how to work with trauma specifically. Here you can do all kinds of things, like from EMDR to psychodynamic therapy to somatic experiencing. There are many kinds of therapies that deal with trauma. The reason why I say this is that trauma leaves something very particular behind. It's like what it leaves is that our bodies, so even when psychologically you feel fine, your body tends to be always very vigilant. So kind of always on the lookout for danger, because trauma imprints that sense of danger directly into our bodies. Trauma, by definition, shatters our ability to make sense of it. There's even one study that says that when trauma is occurring, linguistic centers in our brain just shut down. So we don't have language to describe what's happening, but our bodies still react. And then because that is so unpleasant, so difficult to be with, then what happens is that over time you separate yourself from that experiential layer. It's still there, you're just not fully aware of it. And then working through the trauma and finding ways to feel safe in your own body is probably the key to your healing process. But that is a process and it takes time. So as you work through that, you can slowly replace hair pulling with other soothing behaviors. So habit reversal training may be modified slightly for your specific needs. That's where I would start if I were you. How can I learn about the self-guided manual for habit reversal that you mentioned earlier? Just go to trickstop.com. If you find it on the website, it's there. If you don't find it, it's no longer there. So it's as simple as that. I used to own a copy in PDF, but in the meantime, I have unfortunately changed my computers and I lost a lot of data, so I don't have it anymore. If it has been taken down when the website was redesigned, then unfortunately it's not available anymore. But what you can do, you can join, if that's possible for you due to your time zone, I don't know where you are, you can join our support groups. We have support groups that are free as well. We have special support groups for people who are in the program, but we also have free public support groups. So you can come to the support group and then people who attend the support groups can help you get started with habit reversal training. If you can't afford therapy and you're not too keen on support groups, you can email me and I'll see if I can find some resources online that are reasonable and then I can send them to you. Oh, also, I just remembered we had at least 2 webinars on habit reversal a year ago or a year and a half ago. And one of these webinars dealt specifically with how to start habit reversal on your own. So it was like a self-help manual in video form. So if you want to suffer through another hour of my voice, that's something to find. It's all on how do you call that place? YouTube. Oh, there are a few more people who said, I also like the sound of hair when it gets pulled. And then someone said, I don't like to read the names because I want to keep you anonymous. This is why I say someone. The sound of the hair being pulled is similar to when you crack a knuckle underwater. It's like a muted popping sound. Crack a knuckle under the water. I'm going to try that this weekend since I'm going to the beach, so I will keep you posted what that sounds like. For me, the sound might be a bit like a pluck or a slight snap. Oh, wow, this is really impressive. Like BFRBs are basically half of what I do every day. And I talk to so many people who struggle, and yet I so rarely hear about the sound, and suddenly there's at least a dozen of you that have sent me comments. I hear a sound, it's a popping noise, it's a snapping noise, another one that says it's a snap, one says it's a squeaky sound. This is really amazing. Thank you all for sharing. Actually, if you're in the mood for this, because this is something that's really not written about very much. I've said it like 3 times, so you can see that I'm frustrated. If you're willing, I'll write a blog post about that specific sensory modality. Just send me your descriptions and your experiences with that, specifically with the auditory component, to Vladimir@trickstop.com. And in the next like 2 weeks, I will have some time and I'll write a blog post and I will include your entries, of course, completely anonymously. I think it might be helpful for other people because you don't really hear about this very much. If you're willing to share, of course. Let me just see what time it is. Okay, so let me answer like a random question or two. And then I will have to slowly end this or we will stay here forever. Let me just scroll up and down and see. Okay, so when I'm alone and it's silent and overthinking, maybe, and the hair gets separated from the root, it has a sound like tack, like when we close the pen with the cap, but in a soothing way. And that click is addictive. Is it anything like this? Because I bought a new cell phone and it has that pen, which I absolutely see no use for, to be perfectly honest, except that I love the sound of it. I don't know if you can hear that. I hope you can hear that sound. I don't know if that's what it sounds like, because I find this sound for some reason very satisfying, and I like to play with it until I break it, of course. Thank you for sharing that. What is NAC? So NAC is a supplement. It's actually not even a supplement. It's been downgraded by the FDA. So it's not technically medication, but it is used in medicine. Someone recently told me that it's in one of the webinars actually, that that doctors have even tried using it on people who have COVID. So it's been used widely for different things. It's essentially a supplement, let's put it that way. You can buy it in tablets that I think are like 600 milligrams per piece. You can start with one and then after a week increase to 2 per day and give it 3 months and then see if it works for you. So it's not a particularly exotic substance. You can get it in like Walgreens. So it's easy to get to. Do you think being shamed or judged for pulling by family and parents can just provoke or entice the behavior more, as well as it increasing into other self-harming behaviors? I don't know if it can kind of evolve into other self-harming behaviors. I cannot exclude it just by default, but I don't know that I hear that very frequently. But what absolutely I can confirm is that being judged or shamed can make it worse. Absolutely, because it causes even more stress and more anxiety. So in that sense, you have more triggers. Yeah, it's like adding another unnecessary layer of suffering on top of what is already a very difficult problem. In general, when it comes to mental health, shame is never your ally. Even like in the public domain, where we somehow believe that shaming people will get them to change their opinions, what usually happens is that they just keep their opinions to themselves and still continue to believe what they believed before. They just don't talk about it. And then we live under the delusion that the world is somehow a better place. So shaming never really works. Shame just increases the stigma, reduces your self-worth, makes you more anxious, makes you more stressed, and it gives you more to do in the sense that you now have to be extra careful and extra vigilant to move pulling into this private sphere where no one will see it. So it just gives you more work, but it absolutely does nothing good. So instead, I mean, other people can play a constructive role in the process, but you need to sit them down and explain what kind of feedback you could actually benefit from. If them ignoring it is what you need, then that's what they need to do. I tend to be very uncompromising when it comes to this, because if I need someone's help, then I need help that I find helpful, not the kind of help that they imagine would be helpful. Shaming usually comes from a place of love, but it's extremely damaging. So if they want to help and you tell them that it's helpful not to say anything, then out of respect for you and out of love for you, that's what they should be doing. And that's what you should insist on getting done. Okay, so I see there's at least 15 comments that I didn't get to. So they will have to wait until next time. If you think that you've written or asked something that cannot wait until the next webinar, please email me. I've devoted some time tomorrow afternoon and on Monday. And so I will get back to you by Monday at the latest. So please feel free to email me and I will respond. Thank you all. for being so patient and staying with me for 2 hours now almost. Next time we'll talk about breathing exercises, and we will practice breathing and grounding in the webinar directly. So it'll be more interactive and hopefully easier and useful. So see you in October, and have a pleasant afternoon.